In 2022, Canada welcomed over 437,000 new permanent residents, a record-breaking number that was celebrated as a triumph of diversity and economic growth. But just 2 years later, Prime Minister Trudeau proclaimed that Canada should have, quote-unquote, turned off the taps faster on immigration.
Now, it is time to make the adjustments to stabilize the immigration system that we need and get it working right for Canadians.
The nation faces a housing crisis of unprecedented magnitude, particularly following the pandemic. The average home in Toronto costing more than 10 times the median household income. Canada's response to this crisis? Cracking down on immigration. The stark contrast between Canada's 2022 immigration policies and its subsequent restrictive measures raises questions about the underlying factors driving this shift. As we examine Canada's recent immigration policy changes, we will explore the multifaceted issues that have contributed to this dramatic transformation in the nation's stance on immigration. Canada's immigration strategy saw a dramatic increase in recent years, with permanent residence numbers rising from 286,000 in 2017 to 406,000 in 2021. This 42% increase was a deliberate policy decision aimed at addressing multiple challenges. The Canadian government sought to counteract an ageing population and declining birth rates, while simultaneously boosting economic growth. Immigration was viewed as a solution to maintain workforce productivity, support social programs, and drive innovation through increased consumer spending, entrepreneurship, and filling critical labour shortages. But this rapid population growth had some serious consequences for the country. Between 2016 and 2021, Canada's population expanded by 5.2%, the fastest rate among G7 countries. Yet, essential services and housing supply struggled to keep pace. This disparity has led to mounting pressure on urban centres, where most immigrants tend to settle. Canada's approach to immigration stood out as particularly aggressive compared to other developed nations. The impact on population growth has been substantial, with immigrants accounting for 80% of Canada's population increase between 2016 and 2021. In major cities like Toronto and Vancouver, this figure exceeded 90%, intensifying competition for housing, jobs, and public services in these urban areas. But how exactly is Canada changing course now? Well, for starters, the government has set new targets for the number of permanent residents allowed to enter the country each year. Now, only 395,000 permanent residents are permitted in 2025. In 2026, that number will drop again to 380,000. And finally, that number will drop yet again in 2027, with only 365,000 permanent residents permitted. The government is also reducing the number of temporary residents, including international students and foreign workers. They are doing this by limiting the number of study permits issued in 2024 and 2025, and by working to reduce the temporary resident population to 5% of Canada's total population by the end of 2026. The Canadian government is also tightening eligibility requirements for temporary foreign workers, post-graduation work permits, and work permits for spouses of international students and temporary foreign workers. Prime Minister Trudeau has announced that these policy shifts aim to reduce the housing supply gap, realign housing demand with supply, alleviate pressure on infrastructure and social services, ensure economic growth without a sharp increase in unemployment, and improve wages and job prospects for Canadian residents. It remains to be seen if this sudden change in policy will deliver these desired outcomes, but it's important for Trudeau's government to deliver, as public outcry is raging across the country. Canada's housing crisis has reached critical levels, with the nation ranking last in the OECD's comparison of housing prices to average incomes in 2022. This affordability crisis stems from a complex interplay of factors, including prolonged low interest rates, restrictive zoning laws, and foreign investment, particularly in luxury properties. The rapid influx of immigrants has further exacerbated the acute imbalance between housing demand and supply. The disparity between housing prices and average incomes has become particularly stark in major urban centres. In Toronto, for instance, the average home cost exceeds 10 times the median household income, far surpassing the traditional affordability benchmark. This situation has placed home ownership out of reach for a growing segment of the population, including both native Canadians and newcomers. Immigrants, in particular, face significant challenges in the housing market. Many find themselves in precarious living situations, often forced to share accommodations far from their workplaces due to high rental costs. This not only affects their quality of life, but also hinders their ability to integrate and contribute fully to their new communities. The severity of Canada's housing crisis becomes even more apparent when viewed in a global context. Among G7 nations, Canada faces the most acute housing shortage, a paradox for a country with vast land resources. This reality has prompted a reconsideration of immigration policies, with Prime Minister Trudeau recently announcing a reduction in immigration targets for 2025 to quell public outcry. As Canada grapples with its housing crisis, the strain on public services continues to mount. The nexus between population growth and service demand becomes increasingly evident, particularly in the healthcare sector. Economist Arvind Mageson's observation that increased demand for both health and housing, accompanying large increases in immigration, would further strain both systems, underscores the interconnected nature of Canada's challenges. The housing crisis not only affects individuals and families, but also has far-reaching implications for Canada's social and economic fabric. As the situation worsens, experts warn of potential long-term consequences, including increased inequality, reduced social mobility, and economic instability. These factors collectively pose significant challenges to Canada's ability to maintain its reputation as a welcoming destination for immigrants and a land of opportunity for all residents. As Canada confronts its housing crisis, attention inevitably turns to other sectors under pressure from population growth. How will Canada's already burdened healthcare system cope with the needs of a rapidly expanding population? This question looms large as policymakers and citizens alike grapple with the multifaceted challenges facing the nation. Canada's healthcare system, once a source of national pride, now faces critical challenges. Emergency room wait times have reached an average of 3.1 hours, with some patients waiting up to 12 hours for care. This statistic exemplifies the system's struggle to meet the demands of a rapidly growing population. The physician-to-patient ratio has reached alarming levels, particularly in rural areas and smaller provinces. These regions experience shortages that would be considered unacceptable in other developed nations, highlighting the difficulty in attracting and retaining healthcare professionals where they are most needed. The combination of an aging population and high immigration rates exacerbates the strain on Canada's healthcare system. As the baby boomer generation enters retirement, their increased healthcare needs coincide with the influx of immigrants, crucial for economic growth but adding to the demand for medical services. This dual pressure results in longer wait times for essential procedures and specialist consultations. Regional disparities in healthcare access and quality have become more pronounced. While some provinces maintain relatively shorter wait times and better access to specialists, others grapple with chronic understaffing and limited resources. These disparities create a situation where a patient's postal code can significantly impact their health outcomes, undermining the principle of equal access that underpins Canada's socialised healthcare system. Hospital bed occupancy rates have reached critical levels, limiting the ability to provide timely care and respond effectively to emergencies. Funding allocations for healthcare at both federal and provincial levels has been criticised as insufficient to meet the growing demands of the population, particularly in light of rising immigration levels. The severity of the healthcare crisis is underscored by the unanimous agreement among Canada's premiers that healthcare is the country's top issue. This rare consensus highlights the urgency of addressing these challenges and finding sustainable solutions to ensure the system's long-term viability. As Canadians grapple with these healthcare challenges, public sentiment towards immigration and population growth is shifting. The personal experiences of individuals struggling to navigate an overburdened healthcare system are increasingly shaping national debates on immigration policy and resource allocation. The disconnect between government policy and public sentiment on immigration in Canada has reached a critical point. Recent polls reveal a significant shift in attitude, with the Angus Reid Institute reporting only 13% of Canadians support immigration levels higher than the current rate of 331,000 per year. This marks a departure from Canada's historically welcoming stance and reflects growing concerns about the pace of the population. Over the past decade, public opinion on immigration has evolved towards increasing skepticism. While Canadians generally maintain a positive view on immigration's overall impact, there is a mounting concern that the current influx is outpacing the country's ability to provide adequate housing, healthcare, and other essential services. The debate over immigration policy in Canada encompasses economic considerations, social cohesion, and national identity. Proponents argue that newcomers are essential for addressing labour shortages and supporting an ageing population. Critics, however, contend that rapid population growth exacerbates existing pressures on housing affordability and public services. Pace of demographic change has raised questions about the country's capacity for integration and the long-term implications for Canadian society and its institutions. As public pressure mounts, there are indications that policymakers are beginning to recalibrate their approach. Prime Minister Trudeau's recent acknowledgement of imbalances in the immigration system suggests a potential shift towards a more nuanced policy that better aligns with the public sentiment and infrastructure capacity. However, the path forward remains uncertain. The ongoing debate over immigration policy in Canada reflects broader questions about the country's future trajectory. How will Canada navigate the complex interplay between population growth, economic development, and quality of life? How can it imbalance its economic aspirations and humanitarian commitment with the concerns of its citizens? The answer to these questions will shape Canada's identity and prosperity for generations to come. Canada's rapid immigration surge has exposed critical weaknesses in the nation's infrastructure and social systems, underscoring the complex challenges of managing substantial population growth. These issues highlight the delicate balance between economic aspirations and societal well-being. The nation faces divergent scenarios moving forward. Continuing high immigration levels without commensurate infrastructure investments could intensify existing pressures. Conversely, aligning immigration targets with capacity development might foster sustainable growth. The government's recent acknowledgement of imbalances indicates a potential policy shift. We'll see how this shift fares in 2025.